struggling with painful periods that slow you down. In this video, we're breaking down everything you need to know about menstrual cramps and how to manage them at home. From relief tips and home remedies to lifestyle hacks that actually work. Stay tuned, because by the end, you'll have simple, actionable ways to ease the pain and take control of your cycle. Let's talk about something millions of women experience every month: menstrual cramps. Menstrual cramps are often described as a dull, throbbing pain in the lower belly. They can strike just before your period begins, or during your period, and sometimes the discomfort spreads to your lower back or even your upper legs. But that's not all. You might also notice other symptoms popping up at the same time, like an upset stomach, nausea, vomiting, or even loose stools. Some people also experience headaches, bloating, or dizziness. The intensity of cramps can vary a lot. For some, they're mild and barely noticeable. For others, they can be severe enough to interfere with daily activities, making work, school, or even just moving around feel like a challenge. Here's a crucial point. While it's completely normal to have some pain during your period, extremely intense or unusual cramps could be a sign of underlying health issues that need attention. So knowing the difference is key. In this video, we'll walk you through everything you need to know about managing menstrual cramps at home, helping you take control of your cycle and feel your best, even on your toughest days. Let's get started. Now that we understand what menstrual cramps are, let's talk about practical ways to manage them at home. First and foremost, always follow your doctor's instructions. And if something isn't clear, don't hesitate to ask questions. It's your health, and you deserve answers. Getting enough rest is key. If your body feels tired, take short naps to help ease the discomfort. One of the most effective ways to relieve cramps is heat therapy. Try placing a heating pad or a hot water bottle on your lower belly or back. Remember, 20 minutes is enough, and never fall asleep with a heating pad on, to avoid burns. Warm baths or showers can also do wonders. The heat helps relax your muscles and ease pain while giving you a few moments of self-care. Gentle exercise is another powerful tool. Activities like walking, stretching, or yoga increase blood flow and release feel-good endorphins that help reduce pain. You can also try massaging your lower back or belly in small circular motions. It may sound simple, but it can make a big difference in relieving tension. Managing stress is equally important. Use deep breathing, meditation, or yoga to calm your mind. Stress can actually make cramps feel worse. Finally, wear loose, comfortable clothing. Tight clothes can increase discomfort, so give your body room to relax. By combining these home care tips, you can take control of your cramps and get through your period with more comfort and less disruption to your day. Even after starting home care for menstrual cramps, follow-up with your doctor is essential. These appointments help your doctor monitor your progress and make sure your treatment is working effectively. Sometimes, your doctor may recommend additional tests, such as an ultrasound, CT scan, or MRI. These tests may sound intimidating, but they are simply tools to help your doctor look inside your pelvic organs and identify any underlying health issues that might be causing your cramps. Remember, the goal is not just to treat the pain, but to find the root cause and prevent future problems. Keeping your appointments and following your doctor's guidance is the best way to stay on top of your health and get relief from menstrual cramps safely and effectively. When home care alone isn't enough, your doctor may recommend medications to help manage menstrual cramps. First, there are drugs that relieve pain and reduce swelling. These can help make your period more manageable, especially if cramps are interfering with your daily life. Next, your doctor might suggest hormone balancing treatments, like birth control pills. These aren't just for preventing pregnancy. They can regulate your cycle and reduce the severity of cramps over time. Finally, if your cramps are linked to an infection, your doctor may prescribe antibiotics or other medications to treat it. The key takeaway: medication isn't one size fits all. Your doctor will tailor the plan specifically to your needs to give you the best relief and keep you healthy. Menstrual cramps can sometimes be intense enough to limit your usual activities. You might notice that simple tasks, going to work, or attending school feel much harder during this time. And that's completely normal. It's important to listen to your body and adjust your daily routine as needed. Taking a break or modifying your activities doesn't mean you're weak. It means you're caring for yourself while your body goes through this cycle. Remember, gentle movement, like short walks or stretching, can sometimes help, but don't push yourself into discomfort. Your body needs rest and recovery to manage cramps effectively. What you eat, and what you avoid, can make a noticeable difference in how you feel during your period. First, cut back on caffeine. Drinks like coffee, cola, and even chocolate can make cramps worse for some people. Next, avoid alcohol. Beer, wine, and mixed drinks can increase inflammation and discomfort. Instead, drink warm, soothing liquids like decaffeinated tea or a comforting bowl of soup. Warm drinks can help relax your muscles and may even ease the pain a little. Small changes in your diet can make a big difference in comfort and energy levels during your period, helping you get through the day with less discomfort. Most of the time, menstrual cramps themselves aren't dangerous. They're just your body's way of going through the normal cycle. But here's the important part. Sometimes cramps can signal other health issues. Conditions like endometriosis, fibroids, infections, or hormonal imbalances may show up as more severe or unusual pain. Pay attention to what's normal for your body. If your cramps suddenly become very intense, last longer than usual, or come with unusual symptoms, don't ignore it. Talk to your doctor. Catching problems early can make treatment much easier and more effective. While menstrual cramps can't always be completely avoided, there are some simple daily habits that can make a big difference. Stay active every day. Walking, swimming, cycling, or any gentle exercise keeps your blood flowing and can help reduce cramping. Even a short daily walk can make a noticeable difference. Get enough sleep. Aim for at least 8 hours each night. Your body heals and balances hormones while you sleep, which can help reduce the intensity of cramps. Don't smoke. If you smoke, quitting not only improves your overall health, but may also help lessen period pain. Manage stress. Stress can make cramps worse, so find ways to relax. Exercise, meditation, deep breathing, talking to a counselor, or even practicing yoga can help your body handle stress and reduce pain during your period. Pro tip: combining these habits consistently is often the most effective way to prevent or minimize menstrual cramps. Your daily routine can be your best defense. Knowing when to call your doctor is just as important as home care for menstrual cramps. Here are the key warning signs you shouldn't ignore. Signs of infection. If you have a fever of 100.4 degrees Fahrenheit, chills, or feel generally unwell, this could indicate an infection and you should contact your doctor immediately. Sudden or severe pain. If your cramps suddenly become much worse or keep intensifying, it's a red flag that something more serious may be going on. Persistent pain. Pain that doesn't go away even after your period has ended is not normal and deserves medical attention. Abnormal bleeding. Heavier, more painful periods than usual should be evaluated by your doctor to rule out underlying conditions. Irregular periods. If your period comes very early or very late, it could be a sign of hormonal imbalance or other health issues. Pro tip: trust your instincts. If something feels off or unusually painful, calling your doctor early can prevent complications and help you get the right treatment faster. Before you leave your doctor's office or clinic, it's important to make sure you really understand your care. That's where the teach back method comes in. Repeat in your own words. After talking with the medical staff, take a moment to explain what you learned using your own words. This helps confirm that you truly understand the information. Clarify confusing points. If anything still feels unclear, now is the time to ask questions. Staff can re-explain instructions or tips so you leave feeling confident and informed. Before you go home, make sure you can say these 3 things. I can tell you about my condition. Know what's happening in your body and why cramps occur. I can explain what may help ease my pain. From heat therapy and gentle exercise to medications and stress management, be clear on your personal relief plan. I can explain what I will do if my pain returns or doesn't go away after my period ends. Know the warning signs and when to call your doctor to stay safe and healthy. Remember, teach back isn't just a method, it's your safety net. The more you understand your care, the better you can manage your cramps and protect your health. If you want to dive deeper into understanding menstrual cramps, there are some amazing resources that can guide you. First, the Better Health channel offers clear, easy-to-read information about dysmenorrhea, tips for relief, and when to see a doctor. You can check them out here. betterhealth.vic.gov.au. Next, FamilyDoctor.org provides practical advice from real doctors on managing period pain, lifestyle tips, and treatment options. FamilyDoctor.org. The National Women's Health Network dives into why menstrual cramps happen, what's normal, and what could signal a bigger issue. Learn more here. nwhn.org. And finally, NHS Choices offers reliable, evidence-based guidance from the UK's National Health Service, perfect for understanding both common and severe menstrual pain. nhs.uk. Remember, knowledge is power. Exploring these resources can help you better manage your periods and know when it's time to get help. Thank you for watching our deep dive into menstrual cramps and essential home care tips. Remember, understanding your body and knowing how to manage cramps can make a huge difference in your comfort and daily life. Quick recap. Rest, gentle exercise, heat therapy, stress management, and following your doctor's instructions are all key steps to feeling better during your period. And never ignore severe or unusual symptoms. Your health comes first. If you found this video helpful, clear, and informative, please like this video to let us know you care about spreading accurate health information. Share it widely with friends, family, or anyone who might benefit from learning about menstrual cramps. Subscribe to our channel for more reliable health tips and explanations. Hit the notification bell so you never miss a new video that could help you live healthier and smarter. Remember, knowledge is power, and taking care of your health is the best investment you can make. Thanks again for watching, and I will see you in the next video.